Shri Nama. With great excitement and honor, we welcome you all to the session 3 of Rasamritam Thought-Provoking Talk Series on Rasashastra and Bhaishajya Kalpana. Today's session on clinical Rasashastra is by Dr. Sathyanarayana Vatkila, Principal and Medical Superintendent, Union Institute of Ayurveda Medical Sciences, Manipal, on the topic Rasoushadhi in Rheumatological and Autoimmune Diseases. Dr. Sathyanarayana Vatkila is an expert in Ayurveda pharmaceutics. With over 19 years of teaching and research experiences, he has guided numerous PG and PhD scholars and published 30 plus research papers. He is actively involved in formulation development, quality control, cancer research, and serves on academic bodies including BHU and RGHS. Now, I invite Dr. Ramesh NV, Principal in Charge and HOD, Department of Rasashastra and Bhaishajya Kalpana, for the opening address.
Om Amrita Namaha. My humble pronouns to the lotus feet of Amma. Dear faculty and students. As all of you know, Rasamritam series of talk. Basically, we have started from our department for enriching the knowledge in the science of Rasashastra, specifically clinical Rasashastra for all the PG scholars. So we had two talks from Dr. Anand as well as Rajmohan. And today I'm very proud and honored to introduce Sathyanarayana sir. Generally we speak about after graduation, we can do various jobs. And doing the various jobs is different and excelling in those jobs are different. I think Sathyanarayana sir will be a role model for you for all these things. So he started his career as a student, he graduated from the Premier Institute. And a dream of every Ayurveda student is to become a good clinician. And he's not only a good clinician, excellent clinician. It's not a specialty clinic. He works on different diseases. So if you can ask him to give a talk on clinical Rasashastra, he can give you a list of 100 conditions where he can talk for many hours. In the specialty, he is also a good teacher, excellent teacher. He is also a good researcher associated with many research products. And overall, he is an administrator. So he is doing all the 4 jobs excellently. And actually, we are all, I don't say you, we are all privileged to hear sir for today in our Rasamritam Talk series. I wholeheartedly welcome you, sir. Please enlighten our students, give some confidence to them regarding the clinical application of Rasashastra, especially today as you are talking about rheumatology. Thank you. Welcome.
Thank you, sir. Let's dive into the session Rasoushadhi in Rheumatological and Autoimmune Diseases. For this, I wholeheartedly welcome Dr. Sathyanarayana sir. We are deeply honored to have you here, sir.
Thank you. Thank you for your kind introduction. Namaste, everyone. Am I audible?
Yes, sir.
Yes. Okay. Thank you. Yasmin sarvam yatha sarvam yaha sarvam sarvatascha yaha yascha sarvamayo nityam tasmai sarvatmane namah. At the outset, thank you all for joining me this afternoon. And let me extend my heartfelt gratitude to my dear friend, Dr. Ramesh sir, Honorable Principal of this prestigious institute, Amrita Ayurveda Institute, Kollam. The topic that we had selected for today's deliberation, as all of you know, application of Rasoushadhi in rheumatology and autoimmune disorders. Probably my presentation will be slightly in a different fashion than a presentation of a Kaya Chikitsa person. I will be probably more talking with a focus on Aushadhi and then its effect on the disease. Title is, of course, related to rheumatology and autoimmune disorders. But considering the time frame, I'm afraid I may not be in a position to discuss all these aspects. Probably I will be focusing more on rheumatology, and later probably some other times we will discuss more on autoimmune disorders, because it's a very broad spectrum of conditions where many diseases are involved or many clinical presentations are involved, and it's difficult for us to have a single method of pathological manifestation and line of treatment. However, contextually, I will just touch the topic. We will elaborate more on the rheumatological conditions. Om Sarva Pranaya Vidmahe Yashtihastaya Dhimahi Tanno Vayuh Prachodayat. We know that Vayuh Tantrayantradaraha. At the same time, Vata is a very important factor in the pathological manifestation or the entire process of samprapti of many disorders. And whenever we speak about rheumatological conditions, Vata is extremely important. So let us pray Vayu before starting or commencing today's lecture. Today I am not discussing on etiological factors or etiopathogenesis or samprapti of rheumatological conditions and vis-a-vis correlation of Ayurveda. There may be differences of opinion in considering certain conditions. For example, rheumatoid arthritis vis-a-vis Vata-Rakta or rheumatoid arthritis with special reference to Amavata. Opinion may change in different parts of the country. In Kerala, Vata-Rakta may be considered as rheumatoid arthritis, and in other places, Amavata as rheumatoid arthritis. But whatever rheumatoid arthritis is rheumatoid arthritis, there is no doubt about it. So let me speak in terms of rheumatological conditions as it is indicated in the title. We know extremely clearly that rheumatology is a subspecialty of an internal medicine discipline and also pediatrics. And it deals with joints, soft tissues, autoimmune diseases, and heritable connective tissue disorders. It is nothing but a medical science devoted to the rheumatic diseases and musculoskeletal disorders. Hence, it is the study of autoimmune diseases, connective tissue diseases, both. So a part of autoimmune diseases are covered here. All of us have studied that when we speak about joint disorders, broadly we classify them as inflammatory and non-inflammatory joint disorders. Based on their clinical presentation and also laboratory findings, we are able to differentiate them. Inflammatory conditions may present with erythema, warmth, pain, swelling, prolonged stiffness, systemic symptoms like low-grade fever or even high-grade fever also, malaise, headache, loss of appetite, and laboratory abnormalities like, say, elevated C-reactive protein, maybe in rheumatoid arthritis or in the case of rheumatic fever, or increased RA factor in rheumatoid arthritis, positivity of anti-CCP in rheumatoid arthritis, increased ASO titer in rheumatic fever, elevated HLA-27 in the case of ankylosing spondylitis, positive ANA in the case of systemic lupus erythematosus, or increased ESR level. Like that, there will be one or the other laboratory abnormalities in these inflammatory joint disorders. Whereas in non-inflammatory conditions, mostly it is a mechanical pain. That is, pain worsens with activity. When patient is at rest, he may not experience that much pain. And in addition to that, improves with rest. When patient starts walking, he feels pain. Once he takes rest, pain is improved. But it may not be so in the case of inflammatory joint diseases. And here, stiffness after a brief period of rest. Patient sits or lies down for some time. He feels better, but when he gets up, he feels stiffness, and first few steps are difficult for him. It's not a prolonged stiffness, whereas in the case of inflammatory, it is a prolonged stiffness. Then absence of systemic signs. Say in osteoarthrosis, there may not be any systemic signs like fever, malaise, etc. So this is how we try to differentiate inflammatory and non-inflammatory joint conditions. When we try to differentiate different joint pathologies, we do find monoarticular, oligoarticular, and polyarticular presentations. Monoarticular, where only one joint is involved, it may be because of trauma, or maybe because of hemarthrosis, there will be collection of blood in the joint, or spondyloarthropathy, septic arthritis, which is an infectious one, or crystal-induced, as in the case of gouty arthritis. However, crystal-induced, it can be monoarticular, oligoarticular, and polyarticular, all of them. Oligoarticular, again, in spondyloarthropathy, this is a possibility. Crystal-induced also, this is a possibility. Infection-related also. Polyarticular, more commonly in rheumatoid arthritis, systemic lupus erythematosus, and sometimes infectious, and also possibly crystal-induced. What are the rheumatological diseases that we encounter in our clinical practice? Most important are osteoarthritis, rheumatoid arthritis, seronegative spondyloarthropathy, crystal-induced arthritis, SLE, vasculitis, and some other important rheumatological diseases like scleroderma, inflammatory myopathy, etc. When we speak about autoimmune diseases, they are the diseases that arise from an overactive immune response of the body against our own substances or the tissues that are normally present in our body. Here, the immune system mistakes some part of the body, especially the proteins, as a pathogen and attacks it. This may be restricted to certain organs. We call them as organ-specific autoimmune diseases, or it may involve a particular tissue in different places also. So these autoimmune diseases form a group of disorders in which tissue injury is caused by humoral or cell-mediated immune response. That is, autoantibodies, immunoglobulins, or autoreactive T cells to self-antigens. So normally, immune system does not attack the self. However, there is a large group of autoimmune diseases in which the immune system does attack self cells. And the attack can be directed either against a specific tissue or a large number of tissues. So once it starts, there will be cascade of responses, and it is very hard to autoimmune disease to get stopped. Some examples of rheumatoid arthritis, systemic lupus erythematosus, inflammatory bowel disease or IBD, multiple sclerosis, type 1 diabetes mellitus, GB or Guillain-Barré syndrome, psoriasis, Graves' disease, Hashimoto's thyroiditis, myasthenia gravis, vasculitis, chronic inflammatory demyelinating polyneuropathy, and so on. There will be a role of AMA here, there is a role of Agni here, and in the management, we have a definite role of Rasayana and Agni Dipaka Dravyas in managing many types of autoimmune diseases. So those formulations or methodologies which are having free radical scavenging activities, antioxidant properties are definitely effective in managing many of these autoimmune disorders, but it is extremely difficult to have a common line of treatment for them. So that is the reason why today we will be mostly focusing on Rasoushadhi in rheumatology. So with this background, let us begin just to refresh our memory and to boost ourselves to make us more confident. We will just mention a couple of customary slides on superiority of Rasachikitsa. We all claim that Uttamo Rasavidyastu. Rasendra Chudamani has stated, Swalpahi matra vipula gunascha sadyohi taddipana pachanancha. Small is the dose, high is the potency, and very important is sadyohi taddipana pachanancha. Generally, it is considered that most of the Rasaushadhis are having sukshma vyavayi-like properties, because of which they have a very good bioavailability. More importantly, they act as bioenhancers for the drugs with which they are administered. For example, kajal. Similarly, certain basmas. Alpamatropayogitvād aruchera prasangata kshipramarogyadayitvad aushadhebhyo adhikorasa. Rasendra Sarasangra clearly has mentioned, small is the dose. There is no problem with the palatability. Quick is the action and high is the potency of Rasaushadhis. Sharangadhara has gone up to that level where he states asadhyeshvapi datavyaha rasotaha shreshta uchyate. Even in pratyakshaya conditions, when the terminal patients are coming to you, say stage 4 cancer, we know that it's not curable, but we can definitely try some Rasaushadhis. It is the Rasaushadhis that will come for your help to improve the quality of life of the patient. There is a statement, we consider this statement many times as a prakshipta statement, whether it's prakshipta or an official statement. There may be a misinterpretation of this. That is why I am just mentioning this. Na doshanam, na roganam, na pumsancha parikshanam, na deshasya na kalasya karyam rasachikitsite. Referred in different rasa texts like Rasa Jalanidhi, but quoted in Bhaishajya Ratnavali. Many people present this in such a manner that when you administer Rasaushadhi or when you plan Rasachikitsa, you don't have to assess dosha, dushya, roga, rogi, desha, kala, etc. But that is not the idea behind this particular reference. This reference mainly highlights the role of Rasaushadhi in emergency management. Because all of us have seen when any Rasaushadhi is mentioned or any Maharasa, Uparasa, Sadharana Rasa, Loha, Dhatu, Padatu are mentioned or their Basma are mentioned, Rasa, Guna, Virya, Vipaka are mentioned, Doshagnata is mentioned. When this information is given, it's quite natural that we have to assess all these factors when you plan those medicines in patients. To quote an example, a patient enters your clinic who is coming for the first time. We do not know the history of the patient. He comes near you and he collapses. You examine the patient. His pulse is 3D, very weak, irregular. His BP is very low or not recordable. He is sweating. And you may suspect some cardiac emergency or the patient is in syncope. Now, you do not have any time or possibility to elicit the entire history or assess all dosha, dushya, desha, kala, etc. You have to treat him. Say, take Hemagarbha Potali or Trinetra Rasa that is with you. Just mix it with the Ardraka Rasa and a couple of drops of honey and apply on his gums or beneath the tongue. Maybe in a couple of minutes, patient gets up. His blood pressure is improved. Now you can interrogate him. And if required, you can refer him to higher centers. But this initial management that you could do was because of the excellent clinical efficacy of your Rasoushadhi in emergency management. So even when you encounter such situation where dosha-dusha vivechana may not be possible for you, condition can be handled with the help of Rasoushadhi. That is why this statement is given. In continuation of the same, Bhaishajya Ratnavali also mentions Sarva Shastrarth Tattvajno na janati Rasamvyeda. Person is an expert in multiple scientific disciplines, but he has no knowledge of rasa. Sarvam tasya upahasaya. He will be mocked at by everyone. But when we plan Rasoushadhi in Chikitsa, probably previous speakers also must have explained this, we need to ensure quality and safety of the product. When we talk about efficacy, the first two are most important, that is quality and safety. We expect that if quality is assured, the safety and efficacy are also taken care of. Standard operative procedure is to be followed. There is no shortcut method to prepare Rasoushadhi. So it is clearly mentioned, Samshodhya vidhina dhatu upadhatun mishanyapi yojajet karmani prajno dosha sanjayate anyatha. Proper shodhana has to be carried out for metals, minerals, and also toxic herbs. Then only you can assure safe application of medicine. When we speak about toxicity, ADR, all the provisions in pharmacovigilance, etc., it is important for us to remember and understand that our ancient acharyas, experts of Rasashastra, had a very clear idea regarding the ADRs and toxicity of metals and minerals. They have clearly mentioned what happens if Ashuddha Dravya is given, if Asamyak Marita Dravya is given. And in such situation, what are the possible symptoms that appear and how to treat them? They have clearly given the guidelines for us regarding Shodhana. So this is very important. And another important factor when we administer Rasoushadhi is Anupana, which is grossly neglected by Ayurvedic physicians. There are two important factors which many times we neglect due to the influence of modern medicine. One is Anupana and second one is Aushadha Sevana Kala. Ekadash Aushadha Sevana Kala that are mentioned are highly scientific. So that speaks in terms of our circadian rhythm. It has got a close relationship with various biological processes that are happening in our body. However, now chronopharmacology, chronotherapeutics are the branches that are being developed in other systems. Anupana is not simply to improve the therapeutic efficacy. It is a targeted drug delivery system. It improves bioavailability. It may improve the palatability of the product. At the same time, it may have safety influence also. Anupanai rasa yujja deshakala anusari. Always give Rasoushadhi with a proper Anupana, Sahapana and Anupana, maybe based on Desha, Kala, etc. factors. If it is not possible for you to assess, or there is no any ready-made reference, Doshadhnaihi, at least select Anupana according to dosha, because we know that Sigdoshtam Maruteshastam Pitte Madhurashitalam Kafenupanam Rukshoshtam. And if that is also not possible, use Madhu, which is Yogavahi Param, and also a bioenhancer. Only when it is not possible for you to follow any of these, in certain emergencies, Jala may be used. Why I am mentioning this, that more than other important factors like bioavailability or targeted drug delivery, safety is another important concern in the case of Rasoushadhis. To quote an example of Rasamanikya, late Dr. Sathyanarayana ji worked on Rasamritam both in his post-graduation and PhD level. He carried out acute, subacute, and chronic toxicity of Rasamritam. In animal study, he found that when Rasamritam was given with water as a chronic administration, there was some toxicity, especially there was necrotic patches in liver and also in uterus. But when same medicine was given with madhu and ghrita, as per the classical reference, no toxicity was observed. That means here madhu and ghrita also played the role of cytoprotection. That is why it is important. So in Rasatarangini, always you keep the habit of reading Amayika Prayoga at the end of each dravya, where you will find how a single product, single medicine can be used in multiple conditions by changing Anupana. Now for today's deliberation, I have just classified these Rasoushadhi into different categories. I will be just reading certain names of the products to make you people aware and familiar that so many formulations are available in our textbooks. And only a few, handful of them are in clinical practice. Many are not in practice. We have an opportunity to explore these formulations to a great extent, maybe as a part of our academics or research or in clinical practice. Even pharma industry can think about this. Among those examples, a few we will select and we will slightly elaborate. And at the end, we will observe a few published scientific evidences on the efficacy of these formulations. I have taken these categories: Rasayukta Guggulu Kalpa, Khalviya Rasayana, Parpati Rasayana, Pottali Rasayana, Kupipakwa Rasayana, Lauha Kalpa, Bhasma and Pishti. Guggulu Kalpa, as all of us unanimously agree, are extremely important in joint disorders, in all rheumatological practice. So I have taken only those formulations where Rasadravyas are there, or metals and minerals are there. Next are the Chaturvidha Rasayanas, Kalviya, Parapati, Pottali, Kupipakwa Rasayana. Then Lauha and Mandura Kalpas, and finally Bhasma and Pishti. And under these categories, we will see certain examples. So these are the three conditions that I am going to focus today under rheumatological conditions: Amavata, Vatarakta, and Sandhigata Vata. Now let us begin with Rasaushadhi useful in Amavata. So this is a short list. Mahayogaraja Guggulu, Simhanada Guggulu, Vatari Guggulu, Panchamrita Lauha Guggulu, Shiva Guggulu. 5 formulations I have picked up. Mahayogaraja Guggulu, most of us are using in various clinical conditions. I'm not going to elaborate this. We know that in Sharangadhara Samhita, Yogaraja Guggulu, which is fortified or with the addition of certain metal and mineral ingredients, itself is called as Mahayogaraja Guggulu. It is clearly mentioned Vangam, Raupincha, Nagancha, Lohasaras Tathabrikam, Manduram, Rasasinduram. So when these are added, it becomes Mahayogaraja Guggulu. A practical dose as per AFI is half to 1 gram. Vividha Anupana are mentioned. In rheumatological conditions, Rasnadi Kwatha is an important Anupana. Otherwise, as all of us know, for Yogaraja and Mahayogaraja Guggulu, we have at least 12 different Anupanas mentioned by Sharangadhara. Rasnadi Kwatha Sahitu Vividam Hanti Marutam, Kankolya Drishatat Pittam, Kafam Aragvadha Dina, Darvi Kwathena Mehamsha, Shotam Shulam Kanashritat, Pushtam Nimbashritena Cha, Chinna Kwathena Vatasram, Medo Vridhincha Maduna, Patala Kwatha Sahitu Vividam Hanti Marutam, Punarnavadi Kwathena Hanyat Sarvodaranyapi. Like that, we have a long list of Anupanas. So in all these conditions, Amavata, Sandhikatavata, and the conditions like Kroshtaka Shirsha, where monoarthritis is observed, we have an application of Mahayogaraja Gugulu. Simarada and Vatari Gugulu are similar except for the proportion of Shuddha Gandhaka and air and Taila. So both are Gandha Yukta preparations. 1 shana or 3 grams is the ideal dose. And if you are following proper procedure, you must have already observed that it is not possible for you to prepare Simanada Gugulu into a tablet or pill. It will be in Avaleha form only because air and Taila quantity is high here. Ushnajala can be used as Anupana for Simanada Gugulu, whereas for Vatari Gugulu, Ushnajala or Ushnakshira both are mentioned. Simanada Gugulu has indications Amavata, Vatarakta, Khanja, Pandu and Ushtha. Katishula, Gridhrasi and Vatarakta are mentioned for Vatari Gugulu. In addition to Amavata. One interesting formulation is here, Panchamrita Lauha Gugulu. Available in the market, companies like Duta Papeshwar Limited produce this. This has got multiple mineral ingredients. Quoted in Bhaishajya Ratnavali, Kajjali, Rajata Bhasma, Abhraka Bhasma, Swarnamakshika Bhasma, Lauha Bhasma are present in this formulation. A typical Rasaushadhi we can call it. Even though in classics up to 3 grams it is mentioned, practically around 500 milligram you can give as a dose. Mandoshna Dugdha is mentioned as Anupana. Classical indications are Amavata, Snayuroga, Vataroga and Mastishka Roga. In certain neurological conditions it can be given. And wherever there is any involvement of ligaments, it can be given. And very interestingly, a condition which is highly challenging for us in clinical practice, that is fibromyalgia. Many middle-aged women are suffering with fibromyalgia. Many times features are mimicking the classical presentation of Amavata. In such condition, Panchamrita Lauha Gugulu is found to be beneficial. Shiva Gugulu, again a Gandhaka Yukta Yoga and Eranda Taila Yukta Yoga, having Triphala, Maricha, Pippali, Vidanga, Danti and Rasna, can be given in a dose of about 3 to 4 grams with Ushna Jala. It has a specific indication, Savibandha Amavata. Patient of Amavata when he has a clinical presentation, including constipation. In addition to that, Katishula, Gridhrasi. So in Poshtagata Vata, in Katigata Vata, and in Kroshtaka Shirsha also, Shiva Gugulu can be tried. So these are randomly selected 5 Gugulu formulations containing metals or minerals. Now we will observe Chaturvidha Rasayanas. Under Khalviya Rasayana, Rasaraja Rasa, Brihat Vata Chintamani, Vata Vidvamsa. All these 3 are clinically important and useful in multiple conditions. Maybe in Vata Vyadhi neurological conditions, including Pakshagata, Ardita, Gridhrasi, etc. And also in the conditions like Amavata and Sandhikatavata. Rasaraja Rasa, mentioned in Bhaishajya Ratnavali, has Rasasindura, Abhraka Sattva Bhasma, Swarna Bhasma, Lauha Bhasma, Vanga Bhasma, Raupya Bhasma, Ashwagandha Churna with Kumari Rasabhavana. 1 to 2 rati is the dose, can be given with Madhu, Kshira or Sitayukta Jala. It also has got a special indication in seizure disorders like Apatanaka and Apatantraka. In addition to other neurological deficits as in Pakshagata and Ardita, but has a specific indication in Amavata and Sandhikatavata. Brihatvata Chintamani. Whenever we hear Brihatvata Chintamani, mostly we think about Dhatukshaya conditions or chronic neurological conditions, multiple sclerosis, or a stable cerebrovascular accident patients, but it is very effective in Jirna Amavata. So I have used this in Jirna Amavata condition. It is mostly containing basmas, Swarnaropya Lauha, Pravala Moktika basmas, Rasasindura. Anyway, Rasa Basma is mentioned. Practically, we are using Rasasindura. Kumari Rasa Bhavana is adopted. Can be given with Guduchi Rasa Ajakshira, Brahmi Rasa Madhu, or Yatha Vyadhyanupana. You can select 1, 2, 3 Rati is the dose. It acts as Rasana, Vrishya, and also indicated in Sandhigata Vata and Vata Vyata. Vata Vidvamsana is mainly useful in painful conditions and acute exacerbation of Amavata. And ideally, it has to be given for a shorter duration of time. I have seen some of the patients presented with diarrhea, sometimes gastric irritation, sometimes palpitation, sweating, irritability. So when you give especially Brihat or Mahavata Vidvamsana and the formulation that contains Jayapala Yoga, you need to inform patient that he may have some laxation or sometimes purgation also. And there are a couple of references of Vata Vidvamsana. Vata Vidvamsana from Yoga Ratnakara is selected in the case of AFI, which is mentioned in Shula Rogadikara. And this Vata Vidvamsana from Bhaishajya Ratnavali is in Amavata. Anyway, both of them can be used in Amavata. When there is pain and swelling and patient is unable to move about, give a few doses of Vata Vidvamsana Rasa. You can give it mixing with Ardrak Rasa and a few drops of honey, or simply mix with honey and administer. Maybe in 3-4 days, patient will show dramatic relief. So up to 2 weeks, you can give it at a stress for a better result. In addition to that, you can give it in Manyastambha. In rheumatoid arthritis patient who has got sternocleidomastoid involvement, there also it helps. So recently I had a patient who has pain in jaw, especially right side with the tenderness, and she was feeling difficult to open and close the mouth. And there in Mahavata Vidvamsana, we got considerable good response within a period of a week. We have Amavatari Vatika and Amavatari Rasa. Amavatari Rasa we will slightly elaborate. Amavatari Vatika, classically 1.5 gram is the dose, but half gram is ideal because it has Tamrabhasma and Shuddha Tutta in it. Practically, it is not being used. Amavatari Rasa is very popular. We will slightly elaborate that. Amavatari Rasa that I have taken here is Raso Gandho Varavahnihi Gugguluhu Kramavardhitaha Etadherandatoyena Shlakshna Churnam Prapeshayet Rubutayena Shadgunjo Hantyushna Jalapayinam Amavatam Ati Ogram Dugdham Udgadi Varchayet Shuddha Parada, Shuddha Gandhaka, Trifala, Shuddha Chitraka, Guggulu Kramavardhita 1:2:3:4:5 like that. They are taken. They are made into fine powder and ground well in Eranda Thaila and can be administered in a dose of about 6 rati, say around 750 milligram. Ideal Anupana is Eranda Thaila followed by drinking of warm water. Patient is asked to restrict taking milk and green gram in the diet. Couple of clinical evidences I will mention at the end of the presentation. Then we have Amavateshwara Rasa, Vata Gajendra Simha. Amavateshwara is again a Tamrabhasma Yoga, having Panchakolakvata Guduchi Rasa as Bhavana Dravya. Here we should ask the patient to avoid Katvamla Tikta Rasa. About 500 milligram is the dose. In Amavata, Arsha, Gulma, Shotha it is indicated. Vata Gajendra Simha is again a Tamrabhasma Yoga. It has got a Shuddha Vatsanabha. Up to 3 rati you can give it. Single dose is mentioned Prataha with Mandoshna Dugdha. Another formulation which is highly acclaimed in Bhaishajya Ratnavali but unfortunately not in clinical practice, is Ama Pramathini Vatika. This has got Suryakshara, Arkamula, Shuddha Gandhaka, Lauha Abhraka Basma, and Aragvatha Patra Rasa Bhavana. About 750 milligram or 1 masha is the dose to be given with the Trivrit Kashaya in Amavata. In Rasatantra Sara Siddha Prayoga Sangraha, which is a very useful book for all of us, Ayurveda Sara Sangraha and Rasatantra Sara Siddha Prayoga Sangraha, where how practically these medicines can be used is described and their various Amaika Prayogas are explained. So here author says that Amavata Pramatini practically can be given in a dose of 2 to 4 rati, say 250 to 500 milligram. Morning you have to give it with Trivrit Kashaya and evening with Ardraka Rasa and Mathu. And it is indicated in Tivra Vedana Yukta Evam Jeerna Amavata. The chronic rheumatoid arthritis patient may be having some deformities, but pain is severe. There you can give Ama Pramathini Vatika. Similarly, we have Amavata Drivajra, Amrita Manjari. I am just skipping them because it's a long list. Chaturmukha Rasa, Jwara Murari, Mruta Sanjeevani, Chudamani, Shleshma Shailendra, Lakshmi Vilasa. All these formulations are Jwarahara Kalpas. And you know very well that Amavata and Jwara, they have very similar Samprapti. It is a practice to use Jwaragala Rasoushadhi in the management of Amavata. For example, Mrityunjaya Rasa. My teachers like Professor Muralidhara Sharma used to give Mrityunjaya Rasa regularly in Samavastha in Amavata condition. In the context of Hinguleshwara and Ananda Bhairava, Amavata is already indicated. And among these formulations, Chaturmukha Rasa, you can see in Jwara, you can see in Rajakshmadikara, you can see it in Kasashwasadikara also. One mentioned in Jwaradhikara has to be selected for managing Amavata and Vata Vyadhi, half to 1 rati with the Triphala and Mathu. Next is Lakshmi Vilasa. We have studied about Mahalakshmi Vilasa, Naradiya Lakshmi Vilasa, Lakshmi Vilasa. So in Shiroroga, in Pratishaya, in Rajakshma, in Vajikarana, in Rasayana, in Jwara, so many adhikaras we are finding Lakshmi Vilasa. Many of them have lots of similarities as they contain Kajjali and Krishnabraka Basma in most of these formulations. This one is from Jwara Adhikara. Krishnabraka Basma, Kajjali, Karpura Jati, Kosha Jati, Phala, Dattura Bija, Shodhita, and Vruddhadaru Bija Yukta formulation. 3 rati with Dugdha, Dadi, or Kanji. It is indicated in chronic Amavata. In addition to that, in Pushta, Shiruroga, and Dhatugata Jwara also it is mentioned. Then there are formulations Mahabhravati, Sri Nripati Vallabha, Sri Ramabana Rasa, Ajirna Bhallataka, Vishwoddipaka Abra, so which are indicated in Jwara and also in Ajirna, Grahani, and Jwarati Sara-like conditions. Virabhadrabhraka, Chandra Suryatmaka Rasa, Vidyadharabhra, or few other examples. Shulavajrani Vati is a preparation which was studied in our institute, probably between 2002 and 2005. Dr. Sudhindra Uppur, who is currently practicing in Goa, he worked on this Shulavajrani Vati in the Shastra department. And we found that it is very efficacious in controlling pain in exacerbated conditions of Amavata. And also it has helped to reduce elevated level of RA factor and also ESR. This has Loha Basma, Shuddha Tankana, Shuddha Hingu, Trikadu Trifala Trijata, and Ajadugdha Bhavana. 1 Masha is the classical dose, Sheetala Jala is the Anupat. It's indicated in other types of Shula, Ashtavida Shula, Pliha Gulma like intra-abdominal conditions also, but we found it useful in Amavata. In addition to that, there are a few more formulations that are indicated in different conditions, in GIT conditions, in Yakrit Pliyahadikara, in Upadamsha, in Vandhya Chikitsa, but have indication in Amavata. Say Shankadravako Rasaha, which is a distillate to be given in a dose of 5 drops with warm water. It is found to be effective in Amavata and has got a classical indication also, in addition to Yakritipiliha Udara Rogas. Then Nashta Pushpantakarasa. By the name, all of us know that it is indicated in oligomenorrhea-like condition. In PCOD, it is mentioned. In Rajakshaya, it is mentioned. In Vandhyatva, it is mentioned. At the same time, even in Amavata, it is indicated. Hinguleshwara, Vettumaran Gulika, and Mrityunjaya. All are mentioned in Jwara Chikitsa. All of them are containing Shuddhavatsana as ingredient. You need to be very, very careful. Hinguleshwara Rasa, Gunjardhamadhuna Deyo, 60 milligram. Vettumaran also, half to 1/4 of Rati you can give with Ardharka Rasa, Rasnadikwatha. Mrityunjaya Rasa, starting from 1/4 up to 1 Rati. 1 Rati is the Purna Pramana as per Bhaishajya Ratnavali. You can give it with Bilwa Patra Rasa and Madhu in Amavata. Then we have Kubja Vinoda. When patient has got the presentation of a Kubja, patient has got a deformity always in knees and also maybe in elbows and feels difficult to walk straight. So there Kubja Vinoda, which is again Vatsanabha Yoga and also Haratala Yoga, to be given in a dose of 250 milligram with Madhu, and you can select other Anupana as per the clinical presentation. In Amavata and Katishula, it is mentioned. Amavata Vidhvamsana is also available. So one statement is given in the context of Amavata Chikitsa by Rasendra Sara Sangra, where he says, Ramabanu Rasudeyo Yogavahi Rasendra Kaha Amavate Vidhiyante Sanupanaha Prayatnataha. All Yogavahi rasas that are probably indicated in all Samavastha, including Jwara, can be effectively used in Amavata by using selective Anupanas. Now, next category is Parpati, where we can see Rasa Parpati, Loha Parpati, and Panchamrita Parpati. These 3 Parpati have an indication of Amavata. Rasa Parpati in a dose of 1 to 2 Rati if you are going for a Samanya Prayoga. In Grahani anyway, we require Arohana, Avarohana, Kalpa Prayoga is ideal. In Amavata, even Samanya Prayoga you can try with the Kshira Takra Jira Kajurna Anupana. So if patient is having irritable bowel syndrome like features in chronic Amavata, so this formulation is useful. Similarly, Loha Parpati. And we have seen that many of Amavata patients are presented with Pandu or anemia. So there, Loha Parpati and Panchamrita Parpati both are useful. Panchamrita Parpati, even though is specified more in Sangraha Grani, I have seen some patients of ulcerative colitis who give a presentation of rheumatoid arthritis. I had a patient of ulcerative colitis from South Africa whom we treated with the line of Jirna Pravahika or Grahani, and patient's condition improved. After a month, he had a presentation of rheumatoid arthritis. Maybe in such conditions where there is an autoimmune clear relationship, formulation like Panchamrita Parpati may be more useful. Ghrita and Kshira or Jiraka Churana and Madhu or Ushna Jala and Takra can be Anupana. Under Pottali, Rasagarbha Pottali and Hemagarbha Pottali are indicated. Rasagarbha Pottali 1 Rati, Hemagarbha Pottali half Rati. Madhu will be the Anupana in both the conditions. And very effective under Kupipakwa Rasayana is Samira Pannaga. And next is Mallasindura. Both are arsenic containing formulations. So you need to be careful regarding the dose and duration. Samira Pannaga half to 1 Rati. says 62.5 milligram to 125 milligram. Malla Sindura, half rati, 62.5 milligram. Malla Sindura give with honey and ginger juice combination. Very effective in Amavata. Of course, in Kasa Shwasa, we do give it. Samirapanaga, we also give in other Vata Vyadis, but there are many published literatures on its therapeutic efficacy in rheumatoid arthritis. So it can be given with the Nagavalli Patra Rasa or Ardrak Rasa or Madhu. Samirapanaga can be given for a duration of a month. Malla Sindura, better to limit it for a week or 2 weeks in acute exacerbations, then better to stop it for a certain period, then you can restart. Other arsenic preparations, when you talk about, we usually ask the patient to give it continue for a month or 1.5 months, because arsenic has got a tendency of resulting in cumulative toxicity. And also it may result in oligomenorrhea-like conditions. Makaradhwaja and Siddha Makaradhwaja, both Rasayana and Vrishna preparations can be used in Amavata. Half to 2 rati is the dose of both the formulation. Makaradhwaja with Madhu and Navanita you can give. Siddha Makaradhwaja with Ashwagandha Churna, Madhu, Navanita, Tulasi Rasa or Ardraka Rasa. And this can be used even in the case of presentation of multiple joint pain and swelling, where patient gives the history of a rheumatic fever. Under Lauha Kalpa, we have Trifaladi Lauha, Vidangadi Lauha, Panchanana Rasa Lauha, then Vruddhatarvyadi Lauha, Mahamrutyunjaya Lauha, etc. Chatussama and Amritankura Lauha are also indicated. So I'm not explaining all of this. Amritankura Lauha is a very interesting formulation which is highly potent and very effective in challenging skin diseases and also in Vatarakta and Amavata. This has got a typical method of preparation. You go through the reference in Bhaishajya Ratnavali, and some special Siddha Lakshanas are also mentioned for Amritankura Lauha. You have to start it with 1 rati, go on increasing and reach up to 1 masha, and then again you have to reduce it. Trifalakwatha, Gogruta and Madhu are the Anupana. Even Agnikumara Lauha, which is mentioned in Jwaradhikara, can be used. Under Basma category, Swarna, Abhraka, Pravala, Godanti, Kukkutandattak Basma are mentioned. Swarna Basma is well known in Amavata, and gold compounds were popularized in rheumatoid arthritis management earlier, and nowadays its use is being restricted. It is a good disease modifying agent also, and also it is an immunomodulator. And many formulations became very popular about 3 decades ago containing Swarnabhasma, like Rumayog, Gold, etc. Swarnabhasma has a definite clinical efficacy in Amavata. 15 to 30 milligram is the dose, and considering the expense, nowadays it's difficult to give Swarnabhasma as a single drug. Madhu, Ghrita, Kshira can be the Anupana. Abhrakabhasma, 3 rati or 1 valla with Madhu, Ghrita or Rasnani Kashaya. It's mentioned in all 3 conditions that we have selected today: Amavata, Sandhigata and Vatarakta. Pravala Bhasma, more effective in Sandhigata Vata as Ashthiposhaka. It's one of the best drugs in osteomalacia and osteoarthrosis. Can be used in Jirnamavata also. 2 rati with Guducharasa and Kshira. Godanti Bhasma and Kukkutandatak Bhasma. Both are studied in Amavata and Sandhigata Vata. Godanti Bhasma in Pittanuvandhi Amavata. With Kshira and Shunti Churana it is used. Kukkutandatak Bhasma is given with Navaita and Kshira or Amalikarasa and Madhu. In osteoarthritis and osteoporosis also it is indicated. Under Pishti, Pravala Pishti, Jaharmora Pishti and Akika Pishti are indicated. Pravala Pishti is more specific in Sandhigata Vata and Vatarakta with Kshira and Guduchi Kashaya, 1 to 2 rati. Jaharmora Pishti is useful in rheumatoid arthritis and in rheumatic fever, because it is Hridya also indicated in cardiomyopathy, IHD, with angina, palpitation, tachycardia-like condition. And interesting Anupana mentioned here is Utiha or mint leaf juice and honey. Akekapishti is again indicated in Amavata. It's also Hridya, and in hypotension, palpitation, and in cardiac failure it is used. These are those selected formulations. Now, contextually, I would like to mention a few Anubhuta Prayoga mentioned in Chikitsa Pradeepa. Some of you might have read the text Chikitsa Pradeepa by Bhaskara Vishnu Gokhaleji, who was the first principal of Jamnagar Ayurveda College. So that time IPGT and RA, or currently ITRA, was not there. In 1960s, he practiced. He has immense contribution in Rasa Chikitsa. Many new Pottali preparations he developed, combining various herbs with Rasa Dravyas. He prepared Haramala Pottali. He prepared Dattura Mula Swarasa Bhavita Kajjali. He prepared Kutaja Parpati. Like very interesting formulations he developed. He has written a small book, Chikitsa Pradeepa, where many prayoga are there, which are exclusively based on his clinical experience. In Amavata, he has given some clinical combinations. I have selected only those which contain Rasoushadhis. He has given the combination based on the stage of the disease, like in Amavastha, Pakvavastha, and Jirnavastha. In Amavastha, he has mentioned Simhanada Vata Vidvamsa Mishranam, 4 to 8 Rati, Antara Bhaktam. He mentioned Antara Bhaktam Trivaram may be difficult for you. If you are considering 2 Annakala as classical, only 2 Antara Bhakta are possible. His opinion is that before breakfast and dinner, you have to give it once, say at 11 o'clock. And after dinner and between breakfast and lunch, you have to give once. Between lunch and dinner, you have to give once. And between dinner and morning breakfast, you have to give once. Like that, 3 doses. And this combination, I will mention what is it. With Ushnodaka or Rasashastra Kashaya, you can give. In Pakavastha, where there is redness, temperature, excruciating pain, Samira Yogarajaha, 4 to 8 Rati, same Antara Bhaktam with Rasashastra Kashaya or Kshira, or Simanada Guguru 4 to 8 Rati with Maharasnadi Kashaya, Bhallataka Valeha half to 1 Karsha, Apanakala, just before food, twice a day with milk. Next, in Jirnavastha, Swarna Vasanta Mishranam, 1 to 2 Masha, 750 milligram to 1.5 gram. Again, Antara Bhakta Trivaram with milk. Swarna Yoga Rajaha, 2 to 4 Rati. Again, Antara Bhaktam Trivaram with Maharasnavadi Kashaya. And Gula Bhallataka Harita Kivati, half to 1 Karsha, at bed once with milk. So what are these peculiar combinations that he has mentioned? We will quickly look into them. Simhanada Vata Vidvamsana Mishranam, mentioned in Amavastha, is a combination of Simhanada Guggulu and Vata Vidvamsa. 4 parts of Simhanada Guggulu, 1 part of Vata Vidvamsa. Next, Samira Yoga Rajaha in Pakvavastha. Combination of Samira Pannagarasa, Yogaraja Guggulu, Vata Vidvamsana. 1:8:4 parts. 1 part Samira Pannaga, 8 parts Yogaraja Guggulu, 4 part Vata Vidvamsana. Next, Swarna Vasanta Mishranam in chronic stage. Swarna Malini Vasanta 2 parts. Amapachakavati 4 parts. 750 milligram to 1.5 gram is indicated. Swarna Yogarajaha for Mahayogaraja Guggulu 8 parts. If you add 1 part of Swarna Basma, it is called as Swarna Yogarajaha. Guda Bhallataka Haritaki Vati, again in Jirnamavata. as the name indicates, Guda, Shuddha Ballataka, Haritaki in equal parts. So this is ground together and vati are prepared. 1 to 3 masha is the dose. So here we finish Rasaushadhi in Amavata. I will quickly complete Rasaushadhi for Vatarakta and Sandhigata Vata. Then we will see a few classical clinical evidences. In Vatarakta, there is a huge list. Only couple of them are in practice, unfortunately. Whether it is rheumatoid arthritis or it is gouty arthritis, as many doctors across the country consider, or sometimes maybe thromboangiitis obliterans, which is correlated with Utthana Vatarakta, or scleroderma-like conditions, sometimes psoriatic arthritis-like conditions. Wherever you can correlate Vatarakta, these Rasaushadhis are useful, which need to be tried. Say Vataraktantaka Rasa, Vishweshwara Rasa, Mahatalakeshwara, Sarveshwara Rasa, Mehamudgara, Yogendra. And in these formulations, only Yogendra Rasa and Talakeshwara are in clinical use. Vataraktantaka contains Kajjali, Lauhabhasma, Abhrakabhasma, Shuddha Haratala, Shuddha Manashila. Of course, nowadays Manashila is restricted, but you can get it anyway. 2 to 6 Rati with Nimbapatra Pushpatwak Churna. 1 Shana you have to take this Nimbapatra Pushpatwak Churna, and 1 Karsha of Gogruta is added. Say, take about 250 milligram of Vataraktantaka Rasa, add Nimbapatra Pushpatwak Churna 3 grams and 12 grams of Gogruta and mix it well, make a paste. So this is administered in all varieties of Vatarakta. Vishweshwara Rasa is a Tuttha Yoga. Mostly we do not use Tuttha Yoga internally nowadays, as it can cause nausea and vomiting if you have not properly processed it. This is a Shuddha Ballataka Palasha Bija containing formulation, 2 to 3 Rati. In Vatarakta Kushtha, it is indicated. Talakeshwara, Mahatalakeshwara, all these formulations are mentioned in Kushtha, Vatarakta and Shvitra, these conditions. Talabhasma Yukta Yoga and also Tamrabhasma Yukta Yoga. This Mahatalakeshwara is prepared by doing Paka in Valuka Yantra. It is not a simple Khalva Yoga. Half Rati is the dose with Madhva and Grita. Sarveshwara Rasa is Tamra Bhasma containing yoga, having Swarna Bhasma and Rajata Bhasma also. Here also it is subjected to a Paka in Valuka Yantra. 2 Rati with Madhu, Bakuchi Churna, Devadaru Churna and Erana Tela. In Vatarakta and also in Supti Mandala. In Mandala Kushta, where there is a Supti, as in the case of leprosy, we can use this particular formulation. Yogendra Rasa, all of us have studied this specifically in Vata Vyadhi, in various neurological disorders. It is available in the market. Rasa Sindhura and Swarna Bhasma containing yoga, Mukta Bhasma containing yoga, 1 to 2 Rati with Trifala, Kashaya and Madhu you can use. Under Lauhakalpas, Dwadashayasa, Uduchadi Lauha, Pittantaka Loha, Langalyadi Loha are a few formulations. So one Talabhasma Prayoga I would like to mention. One of our students, Dr. Arya, she did a comparative study of Talabhasma and Rasamanikya in Shwasa. Especially she carried out an in vitro and ex vivo studies, antihistaminic and also bronchodilatory activity she has carried out. And this Talabhasma is definitely usable in clinical practice. In Vatarakta, very unique type of Talabhasma is mentioned. Haritalam palam shuddham tatha karsham visasecha. Take 1 pala of Haritala, Shuddha Haritala, then 1/4 of it, 1 karsha of Shuddha Vatsana. So mix them. give bhavana of Shweta Ankotha Rasa or Shweta Ankola Rasa. And after giving bhavana, prepare chakrika or small bolai. You take a pot, palasha bhasma dvipalam nidhaya. Add 2 pala of palasha bhasma. Tat bhasmopari talasya golakam sthapayet sudihi. 2 bolai or a few bolas that you prepared with haratala and vatsanaba, you have to spread it on this palasha bhasma. Tasyopari apamarga bhasma dadyat palatrayam. On that 3 pala of apamarga bhasma is added. Sthali mukhe sharavancha dadyat yatnena lepayet. Close the pot with the sharava and seal it. Lepayitva tataha chulyam ahoratram pachet bishak. 24 hours you have to heat it. And then you will get tatastu jayate bhasma shuddha karpura sannikham. White camphor like bhasma you will get. This is Shweta Ankotha. And this haratala bhasma you have to take 1 gunja with suitable anupana. It is very effective in Vatarakta and various skin diseases, Kushta, Vicharchika, Charmadala, Galat Kushta, and so on. Then there is another prayoga, Tala Tamra Yoga or Tamra Tala Yoga prayoga. Talena Nihitam Tamram. You have to prepare Tamra Bhasma by using Haratala as a medium. Rasagandhaka Sanyutam. So Kajjali, Shuddha Haratala are added to Tamrapatra or applied on Tamrapatra and subject to Putta. By multiple Putta, you will get a Bhasma. And this Bhasma you have to use in Vatarakta. He said that Bahudha Putitam Talam Vatarakte Mahaushadham. It is one of Shreshta Aushadha in Vatarakta. You can also use Shuddha Shilajatu along with Chinnodbhava Kashaya. That is Guduchi Kashaya. And condition is Panchakarma Vishuddhena Vatarakta Prashantaya. Subject patient to Panchakarma and after Shodhana, Shuddha Shalajatu Prayoga with Guduchi Kashaya is very effective in Vatarakta. Rasamanikya, half to 1 rati with Madhu and Grita, really useful in Vatarakta. Then finally, in Sandhigata Vata, Mahayogaraja Gugulu is indicated. Already we discussed about that. Vata Gajankusha Rasa, very effective formulation in Gridrasi and also in Sandhigata Vata, which is more painful. Mundi Rasa Bhavana is given here. Vata Gajankusha with Shuddha Dattura Bija is more commonly used in Gridrasi in more painful condition. A formulation mentioned here from Bhaishajya Ratnavali, which is Shuddha Vatsanabha Trikatu Yoga, can be used in Sandhigata Vata and Kroshtu Shirsha and Vata Vyata. Kubja Vinoda we already discussed. Bruhat Vata Chintamani, Vata Vidvamsara also we have discussed. Vatari Rasa is an interesting formulation from Bhava Prakasha. It has Kajjali, Trifala, Shuddha Gugulu and Eranatari. And this formulation is indicated in a dose of 1 to 3 grams along with the Shunti Kashaya or Erannamula Kashaya, effectively in both Sandhigata Vata and Amavata. Here also Rasaraja Rasa is indicated. Now let me give 1 or 2 Abhyantara Shamanaushada as per Chikitsa Pradipa. For Vatarakta, in Chikitsa Pradipa, Rasaushadhi are not mentioned. So I have excluded that. So he has given Vata Vidvamsana Mishranam as an effective Abhyantara Shamanaushadhi in Sandhigata Vata. Vata Vidvamsana Mishranam is a combination of 1 part Vata Vidvamsana, 4 part Hingvadi Churna and 4 parts Parasika Yavani. Parasika Yavani is a very good analgesic. Pippali Mula, Chopachini and Parasika Yavani. These are very good analgesic herbs that we have. So this combination 750 milligram to 1.5 gram you can give twice a day Antara Bhaktam with Grita and Ushnapaya or only Ushnodaka. Now, as a last part of this presentation, we will see a few scientific evidences for efficacy of Rasoushadhi in rheumatological conditions. So this study is by Dr. Lavekar and others. And this purpose of this study that I have quoted here is just to make us very clear regarding safety of myography. This is not an efficacy study, this is a safety study. If you remember in the article of Saper et al. Published in JAMA, he has quoted Mahayograjagulu also as a formulation which has very high amount of heavy metals, and he cautioned against this. So Lavekar under the guidance of Ravi Shankar sir and also Vijay Shukla ji and along with the Dr. Ashok BK, they have carried out this study where heavy metal estimation and safety studies of Mahayograjagulu was carried out. They have collected the sample from local market with the help of AIS. They have calculated the amount of heavy metals and 25.8 microgram per gram heavy metal content of lead, 0.07 microgram per gram for mercury, 5.19 microgram per gram for arsenic was present, which is quite high than the safety human dose. But when it was evaluated in animal study in 40 Charles Foster albino rats, which were divided into 4 groups, safety was established. At different dose level, 54 milligram, 270, 540 milligram, that is 5 times, 10 times dose also they tried. 120 days study was done. Ponderal biochemical, hematological, histopathological parameters were used. And there was no significant behavioral changes. There was no reduction in the body weight. There was no reduction in the water and food consumption. No alteration in hematology, serum biochemistry, necropsy was not observed. No histopathological abnormalities. That clearly indicates that Mahayograjagulu, even in a high dose, is safe. This is just to boost our confidence that when Aushadhi is prepared properly, you need not worry about the safety. If you know how to use them, at what dose, with which anupana and how long. Regarding Amavatari Rasa, there are a few studies. Abhilasha et al. Studied evaluation of anti-inflammatory activity of Amavatari Rasa. Here it is an animal study. It is the complete fronts adjuvant induced paw edema. I'm not going for the detail of the study. On 1st, 7th, 14th, and 21st day of injection to the hind paw, with the help of digital plethysmometer, they measured the paw volume. And they have observed that in the group where highest dose of Amavatari Rasa was given, and also in the group where a standard prednisolone was given, in both the groups, considerable decrease in inflammation was observed. Sonam Bhide, under the guidance of Galib sir and P.K. Prajapati sir, has carried out a very interesting study. That is impact of mercury on the efficacy of Amavatari Rasa in rheumatoid arthritis, a randomized double-blind trial. Here, 86 patients were registered in the trial. They were randomly divided into 2 groups, where Amavatari Rasa were administered. In one group, Amavatari Rasa, which doesn't have mercury, was given. In second group, that is ARM, in second group, ARC, Amavatari Rasa containing mercury was given. Both 250 milligram thrice a day, 30 minutes before meal with lukewarm water for 8 weeks. Why this is important? This is important for a couple of reasons. Nowadays, it has become very difficult for us to get mercury because of legal ban, because of black market. Cost of mercury is shooting up 25,000 per kg, it is next to impossible for pharmaceutical industries to use mercury. It is important for us to find out whether without mercury also we can prepare. That is one. Second, all of us know that mercury is yogavahi and very, very important in improving the penetration of the drug. And we need to establish this particular role of mercury in Rasaushadhi. So for these reasons, this study is very important. They assist based on the clinical recovery, symptomatic relief, and pathological investigations. At the end of the study, it was interesting to see that both the groups showed highly significant result in all clinical features except Trishna. Okay, you leave that. Shota, Vedana, all these got remarkably improved, P less than 0.001 in both the groups. Okay. But biological markers, like say CRP, ESR, they responded better in the group where mercury was used. So though there is no significant difference in the clinical findings, but biochemically there is important. So the study concludes presence of mercury is essential that helps in taking the drug to the cellular level and breaking the pathology successfully. Dr. Vijendra Bhatt from STM College of Ayurveda, probably in his thesis under the guidance of Dr. Shilata Kamath, he worked on management of Amavata with Amavata Rasa individually and along with Valokas. Here, one group Amavata Rasa, another group Amavata Rasa with Valokas. 20 patients in each group. Group A took 750 milligram of Amavata Rasa twice a day, 30 days with hot water, an empty stomach. And group B, along with that, 21 days of Valokas. So naturally, a combination of Amavata Rasa and Valakasveda gave better results. Deepika Singh worked on clinical evaluation of therapeutic effect of Amavata Rasa and Chitraka Dichur. This was a rheumatoid arthritis patient. 45 clinically diagnosed patients were studied here. Group A had 13 patients with 500 milligram BD of Amavata Rasa. Along with that, 3 gram BD of Chitrakadi Churna and Valokasveda 10 to 15 minutes. All these three things. This treatment was for 3 months. In second group, whole regimen of Amavata, Langhana, Svedana, Tikta Katu, Deepana Dravya, Virechana, Snehapan and Basti. And in third group, allopathy standard, diclofenac sodium extended release 10 milligram per day was used. So very interestingly, all the groups showed very good result. Almost a similar result. But when we talk about the comparison, trial drug and total regime, where Langana, Svedana, everything was used, showed a better result in additional symptoms, especially symptoms like loss of appetite, flatulence, regurgitation. In all other associated symptoms, complete regimen showed a better result. Again, Sonam Bede has also presented a case of rheumatoid arthritis where she had explained case of 32-year-old female where she tried Amavata Rasa 250 milligram thrice a day. Just a few minutes I will take. Rasaraj Rasa was evaluated by Singh SK, Rajoria and others. And this was a single case report of ankylosing spondylitis. And you know how difficult it is to manage ankylosing spondylitis. And this patient was treated for 2 months with a combination of Panchakarma and Ayurveda drugs. They diagnosed this case as Asthimajjagata Vata and treated with the Shalishashtika Pindasveda for a month. Mustadi Apanavasti with Anuvasana in 30 days schedule with oral medicine. They also followed Pratimarshanasya with Anutaila for a month after completion of Basti. So symptomatic improvement based on the Spondyloarthritic International Society scale was followed. It showed substantial improvement. So during the course of regimen, they used a Rasarajarasa 100 milligram twice a day with honey. They gave this medicine for 2 months in their treatment schedule. I'm not going for the entire treatment schedule in detail. It's available online. It's an open access article. Samirapanaga, I already mentioned, there are many evidences which indicate the clinical excellency of Samirapanaga in rheumatoid arthritis. Mrityunjay Rao et al. Worked on clinical evaluation of efficacy of Pippali Vardhamana Kshirapaka and Samirapanaga. This was a CCRS sponsored project between 1999 and 2004, conducted at Kolkata in Central Research Institute. 157 cases were registered based on American College of Rheumatology revised scale and CCRS protocol. Vardhamana Pippali Kshirapaka and Samirapanaga was given for 6 weeks. Samirapanaga 250 milligram twice a day. And from second week till the end of course, Vardhamana Pippali Kshirapaka was given. Clinical recovery, functional recovery, and improvement in ESR were considered. 55 cases dropped out, 102 cases completed the study. About them, 27 showed excellent response and 50 fair response. That means 77 showed comparatively good response. On Siddha Makaradhwaja also, there is a study by Gajendra Kumar and others. And here, they used the combination of Ashwagandha Churna and Siddha Makaradhwaja. 5 grams of Ashwagandha Churna twice a day for 3 weeks with lukewarm water or milk. Then next 4 weeks, Siddha Makaradhwaja 100 milligram with honey. So this was total 7 weeks regimen. Every 2 weeks they went for follow-up. 125 patients, a good number of patients, got registered for this particular study. And out of which they eliminated a few patients based on the inclusion criteria. 86 patients, they completed the study. So based on American College of Rheumatology, ACR 20 response, secondary endpoint ACR 50, ACR 70 responses, change from baseline in disease activity based on DAS 28 score and ACR parameters. They studied. Safety parameter based on hepatic function and renal function was carried out. 90.7% people completed and 57.7% had high improvement, 42 good improvement. And none of the patients showed any adverse effect. Patient self-assessed disability index improved, ESR level also got improved. Godanti Basma was also tried in Amavata. It's a combination of Shunti Guggulu Godanti. This study was done in Jaipur, again sponsored by CCRS. 47 patients were selected for the study. Shunti Guggulu Godanti in a ratio of 1:2:1. 500 milligram Shunti, 1 gram Guggulu, half gram Godanti. Total 2 grams thrice a day with warm water was given to the patient. And they found considerable good result among 30 patients out of 47. Pravala Bhasma was evaluated for its effect as a natural source of rich calcium on bone mineralization in rats. This is an animal study where overectomized rats were studied, where osteoporosis was induced by overectomy, and Pravala Bhasma was used in test group. There was a significant reversal of osteoporosis when excretion of urine, calcium in urine, excretion of phosphorus in urine, decreased femoral weight and density were evaluated. These conditions were significantly reversed in Pravala Bhasma treated animals. I'm not going for the entire details. This study concludes that Pravalabhasma is effective in the prevention of calcium and estrogen deficient bone loss. So in menopausal women, this is an excellent choice. Some combined therapies are there. In ankylosing spondylitis, there is a single case study where Erandamolaji Kashaya Basti is utilized along with Mahavata Vidhamsana Rasa, Simanada Gulu, and Rasna Saptaka with good results. Then Pandey SCA worked on clinical efficacy of Shiva Gugulu and Simanada Gugulu in Amavata. There are many studies on Gugulu Kalpas, so I'm skipping them. Shivani, Anjana Mishra and others worked on a comparative clinical study to evaluate the effect of Vatari Gugulu and Shatapushpadi Churna with Simanada Gugulu. This is again in Amavata. Study was conducted at Paprola, Himachal Pradesh, where it is said that Vatari Gugulu and Shatapushpadi Churna combination was better than Simanada Gugulu group. There is a study report on management of rheumatic fever. A 27-year-old male was treated who had recurrent episodes of fever, dyspnea, and body pain also. Here, Rasna Saptaka Kashayam, Rasasinduram, and Yogaraja Gugulu were used internally. Churnakili, Churnabasti, and Lavanakili were used. Excellent result was observed in the patient. This is the entire table of the process. So with this, let me conclude my presentation. A conventional Ayurvedic treatment is aimed at reducing inflammation and associated symptoms like pain, swelling, etc., and also at preserving joint function by drugs that suppress the immune system. Rasoushadhi certainly have an edge in managing various types of joint disorders. Swarnakalpa have disease-modifying and immunomodulatory effect in rheumatoid arthritis patients. However, we need to follow a complete approach of treatment, including relevant panchakarma and dietary guidelines for best results. Thanks for your patient listening. Sorry, I have taken a long time. Thank you so much for the